Now it's time for Inspirational Women, and my first guest is Dr. Rosha McCoy, a Senior Director for Advancing Clinical Leadership and Quality with the Association of American Medical Colleges. We're in the flu and cold season, and if the vaccine shots haven't made it to your to-do list, we have Dr. McCoy with some insights on the current state of affairs. Dr. Rosha McCoy, good morning, and thank you so greatly for being with us this morning.
Good morning. Thank you so much for having me.
I really appreciate your availability, and actually that there is this, campaign going on to really highlight, underscore, make us just much more aware of the fact that flu season is here, in case we haven't been actually touched by it yet. But there are a lot of details that we really need to pay attention to. And so I appreciate that we have someone of your caliber really involved with supporting and promoting this with us today.
Sure. Thank you. And I really appreciate you, providing the platform to have this discussion. It's really important. So thank you.
You're so welcome. So, as we look at this, in the fall, we're looking at vaccinations. I think part of it is that kids are going back to school. Perhaps some of this should have already occurred as school has started, but not necessarily. So that is one area, is to look at our children and what kind of vaccines, the immunizations that should happen at this stage of the game.
Right, exactly. So the routine pediatric immunizations, most states have some requirements, and then there are recommendations. So there's, kindergarten is a typical time where kids get vaccines, certainly early childhood, infancy also, and then in the teen years. So trying to make sure kids are up to date and getting the required and the recommended vaccines is really important.
And really, that information, when one has a primary care doctor or seeing a pediatrician, they're going to keep us on track. They'll keep parents really in line with what needs to be done, correct?
Absolutely. And, every visit should be an opportunity to look at a child's immunization status and consider whether they need any vaccines. Because, we call these vaccine preventable diseases. And so if we can prevent an infection and keep kids healthy and keep them in school, that's what we're trying to do.
Precisely. And keep any of the outbreaks of diseases under control, too, because, of course, when it happens in the classroom, it can't help but come home, too.
Exactly.
Right.
Exactly. Yes.
So critically important. So I think the big thing is people think about getting their flu shots. And of course, we've been having the consistent COVID vaccines that keep being updated. And there is, again, a new one for variants this fall. Is that right?
Exactly. So the COVID vaccines, there are 3 different kinds. They're pretty much very similar in the protection that they provide. So they are updated to target the variants that are circulating. I think everybody needs to remember in the summer we were pretty scared because there was quite a few cases all over the country. It was a very hot summer. People were inside a little bit more. So if that happened in the summer, we are concerned that in the winter, where we see many more viruses and many more infections, that things could be difficult if people aren't vaccinated.
So I understand, because I've seen this at my pharmacy, that the new COVID vaccine is now available, right?
Yes, the new updated vaccine is available. There's the Moderna vaccine, the Pfizer, and the Novavax. The Moderna and Pfizer are for anyone over the age of 6 months, and most people over the age of 5 will only need 1 shot. For those who don't want either of those, there is the Novavax vaccine, which is for anybody over the age of 12.
So it's totally what a person feels comfortable with. For instance, I had the Moderna all along, so is it advisable to just do that again?
It really doesn't matter.
Okay.
You can either get the Pfizer or the Moderna. We may want to talk to your physician about it, but really, you don't really need to even do that. It's whatever. Really, a lot of times it's what's available. So some pharmacies carry only one, and others carry only the other. So, whatever's convenient to schedule. And
what about the good timing for it? I'm looking at taking a a trip across country in November. So would it be better to get the vaccine, say, mid-October, or does it matter? Could I take it now and the efficacy just really remains there for, I don't know, how many months?
Yeah, peak efficacy is probably 2 to 3 months for truly peak efficacy. So you can think about your special trip or other occasions that are coming up. But certainly for most people, getting it here soon in late September, early October should be fine, both the flu and the COVID vaccine.
And then with peak efficacy, as you were mentioning, that should take us through the holidays, so we should be good for much of the winter.
Right. And even though we say peak efficacy, there's still a lot of protection from the vaccine for many months, certainly from serious illness and hospitalization. So it's not like, at 2 months everything is gone. It's just the peak is around 2 to 3 months.
Right. And I guess just to have us all really be clear about this, we get the vaccine. That does not mean we will not necessarily perhaps succumb to a case of COVID. But there is, of course, it's still very important to have it because that's really going to help us, isn't it?
Right. And the vaccines are not 100% protective. They don't protect you completely from ever getting the illness. But for a lot of people, they will. I think we think about 45% of people won't get the illness at all or be totally asymptomatic. And then for the rest, it makes it a much less serious illness. So that's why we're not seeing, even though COVID cases are going up, have gone up in the summer, we're not seeing the hospitalization rates go up or the death rates go up. So we really think that's protection from the vaccine and maybe previous infection as well.
It's so important to underscore because certainly I've been consistent with my vaccines, and yet I did have a case of COVID, but I didn't even really know I was sick because I only knew because of doing the testing for it. So for me, I feel, okay, the vaccine really did its job.
Exactly.
Yeah.
And I think that's why, I think people need to recognize and think back to when this pandemic was first raging and we didn't have the vaccine and how scared we all were, and appropriately scared, right?
Yes.
And now with all these tools available to us with the vaccine, and now we have therapeutics for people who are high risk, so you can get treated if you get COVID or the flu, we're just in a much better place, and we should appreciate the fact that we have these tools available to us.
Yes, I think I'm going to wage that the majority of us are feeling that and being grateful for that, having this in our hands, in our bodies. The other thing is that since, or maybe alongside having the COVID vaccines, we then have the RSV, which I've not taken, but I do. The pharmacy keeps saying, this is available. I think our doctors are perhaps going to dictate that whether we should or should not or need to. What do you say, Dr. McCoy?
Yes, the RSV vaccine or respiratory syncytial virus vaccine is recommended for those over the age of 75, or if you're over the age of 60 and have some sort of chronic condition. So you should, if you're over the age of 60, you should talk to your physician, and those over 75 should definitely consider getting it. For little babies, there's another form of protection, which is the monoclonal antibody. So parents should talk to their pediatricians about that. That's especially important if it's the first winter season for a baby. And then certainly pregnant women should seriously consider getting the RSV vaccine to protect their babies.
Excellent. So with having these two major vaccines, the RSV and the COVID vaccine, what about the flu shot that comes along? Is that kind of included in this now, or is there a separate shot? What's the take on that, Dr. McCoy?
It is a separate shot. There's been some discussion that they're working on a combined vaccine, but I haven't seen that out yet. So there is a separate updated flu vaccine, again, targeting what we think will be the viruses for this flu season. So people should consider, most people who are over the age of 6 months need to consider the COVID and the flu vaccines, one shot each for most people. and then the RSV vaccine if you're over the age of 75 or over the age of 60 with chronic conditions.
And in terms of then getting the vaccines, say it's just the COVID and the flu shot, can you get both at the same time, or does there need to be a space of time between?
Yes, you can certainly get both at the same time, and we're all very busy, and it's hard to keep going back for vaccines, so we do recommend people getting it at the same time. If you don't get it at the same time, there's no special spacing that's needed, so you could get COVID one week and flu vaccine the next week. RSV vaccine, you could get all three at the same time, but older adults should talk to their physicians about what the best plan is for them.
Because I know that I've heard of cases where persons getting the COVID vaccine will have some symptoms following getting the shot. So that, I guess, might happen also with the RSV?
Yes, both, all of these shots, you can have some pain at the injection site. You can have a little bit of aches and pains and maybe a mild fever. So there are a few mild side effects. So certainly flu and COVID you can get together, and most of the side effects are very similar, and it shouldn't be a problem for most people. RSV, you might want to space that out, but if it's more convenient to get all three, it's a discussion to have with the person's physician.
Right. And so if we happen to have a reaction after getting the shot, no cause for concern. In fact, if anything, I wonder, is that a sign that we're kind of building the antibodies?
Yeah, I mean, whether you have side effects or not, we don't really know if that means anything in particular. But certainly for the vast majority of people, they either have no side effects or very mild side effects for a day or two.
Right, yes. Well, 'tis the season, and so this is so timely that we are making sure that people are aware, make the plans to get this done for yourself, for family members, just really looking out for each other. So that's critical. Dr. McCoy, does anything else stand out in terms of what we really need to be aware of and do for ourselves in terms of staying healthy?
Yeah, I think it's common sense. I think we all need to make sure that if we do get sick, that we don't expose other people. So staying home while you have a fever, while you have some symptoms. If you don't have a fever and it's been more than 5 days and you're going out, try to wear a mask if you still have a cough or a runny nose. So good hand hygiene, staying healthy, well hydrated in terms of drinking a lot of fluids, and also making sure you have a healthy diet. So all the common sense things as we get into flu and viral season is really important.
Oh, yes. Thank you for recapping all of that. And your mentioning of masks, that is one of the things that I think has been a good benefit after the whole COVID situation we went through, that some people seem to be more conscious of thinking of that, both for their own protection, but for others as well, is to use those masks. And of course, the sanitizing our hands, very big things.
Exactly.
Yes.
Exactly.
Well, this has been really such an important connection to have, and an important timing for this as well. I do appreciate your work, Dr. Rosha McCoy, and I know it's all part of the Association of American Medical Colleges. So there's such a vast group that's come together to assemble this information and really be promoting this good advice and recommendations, correct?
Yes.
Yeah.
And we've had a lot of help and a lot of partnerships. We've worked with the CDC. We've worked with our member institutions, and really, trying to keep our communities healthy and listening to folks' concerns and then making sure we're addressing them.
Well, I feel that we did a fair bit of that. I hope we really answered questions. But if people needed to, there is a website, too, that they can refer to for some good direction as well, right?
Yes, we have our own website called vaccinevoices.org, and then certainly the CDC website, cdc.gov, is a very good website. The American Academy of Pediatrics has a lot of information on childhood vaccines, so I encourage people to look at that as well.
Wonderful. Well, you're wonderful. I am so grateful that we've had this time together, and I appreciate it. I wish you continued success in making good connections.
Thank you so much, Kate.